Hi there, my name's Pichierri. I'm one of the diabetes nurses at the London Diabetes Centre, Birmingham, and I'm a diabetes specialist nurse. I'm just going to give you a bit of an overview today of the services that we can provide at the clinic and more specifically what the diabetes nursing team can do for you. So a little bit more about me. I'm by background a paediatric nurse. I did my training at Great Ormond Street. I've done lots of different things. I've done lots of work overseas. I've had some accident and emergency experience. And I've spent 11 years being a diabetes nurse, predominantly in paediatrics. And so that's the sort of thing that you can look to expect at the London Diabetes Centre, Birmingham, is that nurses and doctors coming from all different backgrounds and different specialities, most of us work or have worked in the NHS and have got NHS experience and have brought our skills over to the Diabetes Centre here. So just to give you an idea a bit what you can expect of a specialist nurse and what we hope that we can provide for you. It's to have a unique and a specialist insight into a particular condition or a set of conditions. So in this case, obviously diabetes. Specialist nurse will only focus on diabetes and look to support you with your diabetes care. We would try and help you to navigate the healthcare system, try and find a package that best fits your needs, will be concerned specifically with you and your family's needs. And we hope to develop a relationship with you over time, you and your family, get to know you, specifically what you need and your teachers maybe, also if you're school age. It's about giving you a more personalised experience. And hopefully, you know, the job of a nurse really is to help you to better understand your condition and to give you all the tools in the toolbox. So we don't like to keep all of these tools a secret. You know, my job's not a secret. What I'm here to do is to help you to manage your own diabetes better, or to manage your own child's diabetes better. So we want to give you all of those skills as we go along. So it's about teaching you to manage your own diabetes and to live your best life. So I guess the question is, how do you want your diabetes to be, or how do you want your child's diabetes to be? What would life look like if diabetes was perfect? When I ask most people this question, they say, I just wish I didn't have diabetes, that it wasn't there. So that would be the best that diabetes could ever be, is if I could wave my magic wand and get rid of it completely. But unfortunately, I don't have a magic wand, but what I do have are some skills and knowledge, which hopefully I can impart onto you. So probably you also wish that your diabetes was under better control, that you knew what was happening, that you knew why you were high, why you were low. You were able to look at, if you're using continuous glucose monitoring, able to look at it and understand the reasons why you're high or low. I bet you'd wish that diabetes felt like less of a burden, like something that you didn't have to think about all the time, 24 hours a day, that you could get a bit of spontaneity back into your life. Maybe you wish that you were able to think about other things more, and that diabetes wasn't such a prominent feature. And most people say to me that they wish that they could just live a normal life, that they could feel normal again, and live a life without restrictions. So hopefully with some specialist nurse input, those are the sort of things that we can look to do for you. So how do you want your diabetes care to be? You know, the world of private care at the London Diabetes Centre, Birmingham, would be very different to your experience of NHS care. So, because obviously in the NHS, there's lots of patients that need lots of things and not so many staff to do that. What do you want your care to look like? Available when you want it, able to access prompt and efficient support when you need it, rather than waiting for hours or days or weeks for a response to an email or phone call or no response. You want it to be flexible, so that you can have that care when you want it, that it fits your needs, that it's specific to you, that you're able to talk to a nurse or a doctor and get the care that you want and the information that you want at that specific time. I often find that with diabetes that it's a quick fix that you need, that you're sort of in crisis mode and you need somebody to tell you what to do there and then. You know, often I find with patients, if you give it a week and you ring them a week later after they've sent an SOS email, the crisis is already over and the problem is solved. So diabetes often needs a quick fix. So being able to speak to somebody quickly and for them to give you a quick answer and some action points for you to work on straight away. And probably one of the major things would be for funding not to be an issue. Unfortunately, you know, the way things are at the moment, you know, with the NHS, funding is an issue, and you can't always get the technology that you want, the equipment that you want. So it'd be nice to live in a world where funding wasn't an issue. So we've looked at what you want it to be and how you'd like your care to be, but how do you feel at the moment? So, you know, some of the things that patients say to me is that they feel out of control, they don't know where to look for help, they feel frustrated, frustrated with diabetes, frustrated maybe at not being able to access the system as quickly as they want to, needing support but not knowing where to turn, feeling like, you know, maybe your GP doesn't hold the answers, maybe your current team doesn't hold all the answers all the time to give you. You can't see the wood for the trees. You know that something needs to change, but you don't know what. You know, those are the sort of things that we can provide you with, just to step back, being able to look at diabetes, you know, from an outside perspective and take a look in. People often say they just need a quick check-in with a nurse or a dietitian. They don't need hours and hours of consultation. They just need someone to take a quick look at things for them. Maybe you're wanting to move forwards and you're feeling stuck in a rut. Maybe you feel like actually things are all right with my diabetes and they've been all right for a long time, but I'd like to move forwards. I'd like to take things forwards. I'd like to start to use some of this CGM that I've heard about. I'd like to at least have a look at what the possible pump options are or the closed loop options. Maybe you've heard all of these things and you don't know whether it's, you know, whether it's truth or myth, whether these things exist or not, and you'd just like to have a chat with somebody about all the available technologies, you know, any new insulins that are on the market. Maybe you just want a bit more of an insight and knowledge into what's available and what you could potentially have. Or maybe you want some access to some of all this magical tech that we hear about on all the various blogs and Facebook pages and things about all this amazing tech, but you just can't access it because, you know, your NHS team doesn't offer it, or that they've got you know, limitations and very strict criteria and guidelines around who can have it. You know, this might be your opportunity to think, okay, I want to explore that, and we can help you with that. So for many people, they say that coming to see a nurse or a doctor at the London Diabetes Centre is a way to make a positive step forward, a step forward into feeling like I can regain some control. You actually feel like you're doing something. So there's all sorts of things that we offer here. There's a peace of mind package, which means that you would hook all of your CGM or your blood glucose data and pen data up to us. We can have a look at that on a weekly basis, just have a check-in and see how things are going. You can have remote appointments with a nurse or a consultant, or face-to-face appointments if you prefer. And we're just here to give you a starting place, you know, on what diabetes could be. So some of the other services that we're able to offer, patients often worry about coming to see a nurse or a doctor privately. What does that mean for their NHS care? We strive to work alongside GPs and NHS teams. It's obviously really important that we all work together, that we're all singing from the same hymn sheet. So we try to liaise with GPs and with NHS services, so don't worry about that. We're able to offer you access to the latest technology. We've got access to, you know, the reps, various pump reps and continuous glucose monitoring reps. We try to keep ourselves up to date with, you know, what's out and what's new, and pass that information on to you. You're able to come and see a team that maybe is a bit more energized, with less time pressure, and less general patient pressure and work stress. So coming to see a nurse or a doctor and feeling that the time that you've got with them is yours. We hope to provide you with a more relaxed environment and appointment times that suit you, times and dates that suit you. And we're able to focus on specific concerns that you might have and tailor the care exactly to what you want, to what you're looking for. We can discuss beforehand exactly what your objectives are for the appointment, and so you can get more of a bespoke service. You set the agenda. So what you want is what we'll provide for you. You could come to the centre for a one-off appointment. You might be looking for, as I said, the peace of mind package, which is something that, you know, we're just looking at levels, you know, on a weekly basis, having a look at data on a weekly basis and just making sure that everything's ticking along nicely. You might want to come and see a nurse specialist. You might feel that you need more of a consultant input. We've got dietitians, so it might be more of a dietitian input that you're looking for. You might be looking for a more long-term care and support, wanting to see somebody regularly, or it might be just a one-off thing that you want. We can talk to you about pump starts and pump upgrades. So you might already be on a pump and looking for some new technology, a new pump. We can offer continuous glucose monitoring and have a look at what continuous glucose monitoring system might be better for you. And tailor it more to your needs. So as I said before, one of the things that can feel really frustrating about waiting for appointments in the NHS is that it can feel like it takes an age, particularly with the way that things have been recently. You know, the NHS has really been under pressure, and a lot of things like diabetes and chronic conditions have sort of fallen a bit by the wayside, and patients are having to wait longer and longer for appointments. You're really not getting to know the team, and the team aren't getting to know you. You're waiting a year for an appointment. You know, some patients are saying to us that they haven't seen a nurse or a doctor in a couple of years. So it can be really frustrating, and you might just feel like, I just want a quick check-in. I just want to see a nurse or a doctor just to see how I'm going and get some pointers, and then we can try and help link you back in with your NHS team. As I said before, we do have access to the latest technology. We've got time here at the London Diabetes Centre to look at all of the latest technology, to have those conversations with reps, to keep ourselves in the loop, to keep up to date with the research. And so hopefully we're able to provide you, you know, with the latest information and technology. We might also be able to provide you with some complementary services, like linking in doctors and nurses and dietitians all together, if that's more of the sort of thing that you're looking for. And as I said before, we try and keep everything integrated with your NHS care. As I said, most of us have worked for the NHS in the past, or still do work for the NHS, so we know how the system works. So we're here when you need us.